Hi. Today let me talk a bit about cancers. What are cancers? Normally, what happens inside the body are the cell is born, it attains maturity, then it reproduces and divides in a controlled and a regulated fashion. Then it undergoes death, the programmed cell death, which is also called as apoptosis. But what happens in cancers is um, cancer actually is abnormal, unregulated cell proliferation or cell division together with abnormal cell growth, giving rise to lump, mass, or tumors. Uh, Around these abnormal cells, which keep on dividing on and on and on, there's formation of blood vessels. These are abnormal blood vessels to feed these abnormal cells, such that there is formation of mass or a tumor. So this is what cancer is. Now cancers can be benign cancers or metastatic cancers. Benign cancers are localized to one area, whereas metastatic cancers spreads through blood or lymphatics to other areas. The most common, almost all the cancers can metastasize. And the most common sites of cancers to metastasize are brain, lungs, liver, and bones. So now coming to the signs and symptoms of cancers. Um, how one may present if one gets affected with cancer. There may be unexplained weight loss. Second, there may be abnormal bleeding or heavy bleeding or discharge as happens in cervical or endometrial cancer. Then there may be hoarseness of voice as happens in laryngeal cancer, or there may be prolonged cough as happens in lung cancer. There may be change in the bowel and bladder habits as happens in colorectal cancer. Then um, um, uh, um, then there may be obvious change in the wart or mole which happens in the skin cancers, or there may be formation of abnormal lump or mass in the breast or elsewhere in the body. So now coming to what causes these cancers. There are several many factors leading to cancers. The most prominent amongst these are lifestyle changes. Excessive tobacco use such as cigarette smoking, alcohol abuse, dietary dietary factors such as taking too little of dietary vegetables as well as fruits, and taking more of red meat such as pork, beef, or lambs. Um, then infectious causes, mostly viruses are implicated in the in the etiology of cancers, such as human papilloma virus causing cervical cancers, hepatitis B and hepatitis C virus causing hepatocellular carcinoma, then HIV, HTLV1 virus causing T cell leukemias, and so on. Also, certain bacteria such as Helicobacter pylori causes gastric cancers. So, what are the various investigations, or how can a cancer be investigated? How can a cancer be brought to light? So, the signs and symptoms are itself an indication of cancer. So, your doctor assesses and gets a clues from the signs and symptoms that you present with. Second, one of the confirmatory tests is biopsy. Biopsy of a mass is taken and the histopathology of the cancerous cells is studied, and the pathologist reaches a conclusion. And these days, PET scan has emerged as a newer modality for the detection of cancers. It uses glucose isomer 18. Um, you can think that way, as if the cancerous cells eats up glucose, and so the uptake of glucose is increased by cancerous cells, and a CT scan is done under this. So this is how a PET scan works. So the treatment modalities of cancer are chemotherapy. Chemotherapy are therapeutic drugs which are given to cancer patients, that is antineoplastic drugs, which are themselves very toxic. Then the radiation therapy. Radiation therapy basically destroys the or dismantles the DNA of the cancerous cells, the abnormally dividing cancerous cells, immunotherapy, and the hormonal therapy. Surgery usually may be done for localized tumors, and it involves the removal of localized mass together with the lymph nodes that facilitates the spread of localized tumors. And just as far as prognosis are concerned of cancers, about 66%, the 5-year survival rate in US for all types or roughly all types of cancers was 66% as stated. So in brief, this was all about cancers. Thank you.